it's $600 for the list price of the EpiPen. You get $274 for that. All the middlemen, as you say, are getting $334 per the EpiPen. Who are these middlemen that are driving up the price, you say, of the EpiPen?
And I would say not driving up the price, but they're all contributing to the price. And they all have an important role. All the middlemen, from wholesalers to insurance to PBMs, they're all playing a part.
That is Mylan CEO Heather Bresch breaking down the price for us of her company's life-saving EpiPen. The device became a focal point in the debate over the rising costs of pharmaceuticals. PBMs, those are pharmacy benefit managers, negotiate drug prices directly with drug companies. They work on behalf of insurance and employer groups that pay for drugs. The companies act as middlemen and collect rebates and other fees. PBMs say they are the ones trying to lower drug prices. Express Scripts is the largest pharmacy benefit manager with more than $102 billion in annual revenue. Its CEO, Tim Wentworth, is with us. Good morning.
Good morning, Nora.
Thanks for joining us, since you're one of the middlemen.
I appreciate being here in the middle of all of you.
Yeah. For those that don't understand the whole system, first, do you agree with Heather Bresch that there's a lack of transparency in drug pricing?
I think it depends on sort of where you look. I think from a standpoint of the 3,000 clients that we have and 80 million lives we cover, they know exactly how the dollars flow and so forth. Those clients do rather. I would tell you that at the patient level, it has gotten more complex as you've had high deductible health plans and those sorts of things in terms of the patient knowing and navigating to the lowest cost. And that's where we really have a job to do.
What do PBMs do?
So in a nutshell, again, on behalf of 80 million patients, we take care of them in terms of we have deep specialist pharmacy practice. We negotiate with drug companies, as you said, to get the prices down. And then we also negotiate with retail pharmacies. As you know, there are 70,000 of them in this country. And by narrowing down the choices to a reasonable number there, we can get significant discounts there.
So my understanding, though, is that just as a drug company, when the price of a drug increases, you get a rebate. And that rebate actually gets larger. So everyone benefits from a higher drug price, including PBMs.
No, we quite frankly would be quite happy to not have high drug prices. If you look at the PBM model, we benefit the most when we can actually drive clients to generic penetration where there are no rebates. And when we do obtain rebates, our clients determine and helps them stay in the benefit providing business, as it were. So those rebates flow through us. 100% of the time, our clients determine where it goes. But let me make the point. Pharma companies determine their prices, and pharma companies determine whether or not they want to discount their price at a net cost level through rebates or whether they want to lower it to a list price that's discounted.
But
they've chosen rebates.
Consumers sit there, Tim, and they listen to you and say, look, it sounds good what you're saying, but all I know is it costs me a lot to fill my prescription. Sure. So we're pointing fingers all over the place, including at your company. What is the advantage of using a PBM as opposed to just negotiating directly to the drug company? Why can't we just do that?
The role that we play with aggregating those 80 million lives enables us to make wholesale changes to the system. If you look at what we did with hepatitis C, we brought that price from nearly $100,000 a cure down to below $50,000 a cure by bringing an entire population to the table and showing that manufacturer they could access those patients if they got the price right. That's what us doing our job enables.
This is a cause that President Trump has now taken up. What could the administration do here?
Well, I think the administration can look to what we've already done to sort of look forward. If you take the Department of Defense, using something like a PBM, using our company, Express Scripts, he can put into place a program that helps our payers across the piece keep their prices low by virtue of letting us continue to negotiate with pharma manufacturers, letting us to continue to do the things that we do, and most importantly, letting us invest in that patient tool set that enables the 80 million people that we have and the hundreds of millions of people in our country, as their benefit designs change, navigate through the lowest cost.
So this is complicated, but I think I understand it pretty well. And I understand, like a pharmacy benefit manager, you're saying we can buy in bulk. That's why we can negotiate with pharma. We can help reduce the price of a drug, as you pointed out. Then why does the price of drugs keep going up? According to your own report, it went up 11% last year.
It did, on a gross basis. And the good news for our
But
clients.
you've got good news, though.
Yeah, the good news is for our clients, the unit price of drugs went up 2.5%. And the way that happens, I can't explain. You need to have a pharma company CEO explain why they keep raising the prices. I saw your interview with Mylan, and I heard the explanation. It doesn't make sense to me, because at the end of the day, from a standpoint of drug prices, the pharma companies are making that determination. Our job is, quite frankly, to the extent that they've been inflating them, to go and make sure our clients don't pay those higher prices.
But just to answer this question,
sure.
When the price of drugs goes up, does the rebate you receive also go up?
Not always, but when it goes up, it then flows through to the clients as we've predetermined with our clients.
See, then to Gail's point, though, if I'm just sitting here watching this right now, it does seem as though they're just fingers being pointed back and forth, and I'm forced to decide who the bad guy is.
That's it, and I understand that, but what I'd say is when you look at what we do and the results we got, again, our report yesterday shows that it may not be simple. I'm not going to sit here and tell you it's a simple process, but we get results.
Could you make public the amount PBMs receive in rebates? Could you make that more transparent so that the consumer, the patient, could understand this supply chain? Who is getting a cut of every piece of the drug before it reaches the patient?
So
would you support that?
We support absolute transparency with our clients, and we support as well transparency with patients. In fact, we have clients where the rebate in part is also taken to the point of sale for the member. That's really a client decision based on how they're overall funding their program. So we absolutely support that kind of transparency.
Yeah. The only reason I say the interesting thing is when we go to the store, an over-the-counter drug, we can see the price underneath, and we can make a choice about which drug to choose. That doesn't exist among prescription drugs.
Actually, for our patients, they can go online and use our digital tools that we've made significant investments in, and see they can see their balances in their high deductible plans across medical and pharmacy. They can see the price of a drug. They can see the lowest cost retail pharmacy to get that drug at, or even better, they can get 90 days at mail in many cases, and they can see exactly what they're going to pay.
That's helpful. Thank you.
Complicated,
That's good
but there are
information.
solutions.
Yeah.
There are solutions.
Transparent.
Thank you, Tim.
Good.